Good morning, afternoon, everyone, and welcome to our virtual panel discussion. Today, the Atlantic Council and the Syrian American Medical Society are honored to bring together a distinguished panel of experts to explore a critical issue, serving communities with disability in conflict contexts. My name is Diana Reyes. I will be your moderator for today. I'm a PhD candidate at the Johns Hopkins Bloomberg School of Public Health, specializing in the impacts of conflict and displacement on health, as well as the chair of the Syria Public Health Network, which is a platform for discussion and policy analysis on health priorities emerging from the Syrian crisis. Today's discussion centers on a critical and often underlooked population, people with disabilities. Over 1 billion people worldwide are living with some form of disability, 16% of which are attributable to armed conflict. We know that populations are already prone to many vulnerabilities in conflict zones. For people with disabilities, these challenges become a matter of life and death. Escape routes may become inaccessible, and some are physically unable to flee to protect themselves or their loved ones, leaving this population more susceptible to human rights violations, exploitation, and potential abuse. Higher poverty rates fueled by the conflict force these populations into situations that negatively impact their health, including lack of access to resources like water, sanitation, food security, and livelihood. Recovery after conflict is equally a challenge. Limited services and breakdown in essential infrastructure threatens access to healthcare, transportation, communication, security, and housing, to name a few. For survivors of explosions and violence, access to prosthetics, physical therapy, and mental health care are often scarce and inhibit their ability to regain independence and rebuild their lives. Today's panel aims to address these issues head-on, exploring evidence-based practices and solutions for supporting individuals with disabilities caught in the throes of conflict. Syria is one such context where the impact of the more than a decade-long conflict on people with disabilities has been tangible, with estimates suggesting about 1.5 million Syrians acquiring disabilities due to the conflict. In 2022, the Syrian American Medical Society, or SAMS, took an important step by completing its first long-term research project on disability and accessibility in its facilities across northwest Syria. This groundbreaking research, which included a survey of both staff and beneficiaries, provides valuable insights to the challenges faced by this vulnerable population. Over the next hour, our panelists will delve into the findings of this research and explore how they compare to accessibility issues in other conflict zones globally and including Ukraine. Through their expertise, we hope to gain a deeper understanding of the specific needs of individuals with disabilities in conflict settings and identify effective strategies to ensure inclusion of these populations in humanitarian and development planning programs and policy. We will save about 15 to 20 minutes at the end for Q&A from the audience, so please post your questions throughout. And without further ado, let's give a warm welcome to our esteemed panelists, and I will share their bios and backgrounds in the order in which they will present. First, we'll hear from Ala Zaza, who at the time of the report was an advisor on disability rights with the Syrian American Medical Society. Ala is a humanitarian leader with extensive experience in managing emergency and multi-sectoral humanitarian projects. He's worked on disability inclusion policy reform with Save the Children, Chemonics International, and Adam Smith International in the MENA region. Ala holds a master's degree in special education. We'll also hear from Special Advisor on International Disability Rights, Sara Minkara, who's at the U.S. Department of State, Bureau of Democracy, Human Rights, and Labor. As a senior diplomat for disability rights, Special Advisor Minkara leads the U.S. comprehensive strategy to promote and protect the rights of persons with disabilities internationally and across our foreign policy. Ms. Minkara has advised and addressed numerous academic, government, and policy groups on issues related to disability, inclusion, adaptive leadership, and social entrepreneurship, including the UN's in New York and Vienna, tours in Africa and Asia on behalf of the State Department, and speaking engagements across 5 continents. She's been recognized for her many contributions through appointments and awards, including honors from the Clinton Global Initiative, MIT, Forbes 30 Under 30, Harvard, Halicon, and the Vital Voices, 100 Women Using Their Power to Empower retrospective. We'll also hear from Helena Corella, who's calling from Ukraine. She's the Director of Disability Rights International and oversees the Disability Rights and Inclusion for Ukraine as the Rapid Response Director. She's a Ukrainian women's rights and disability activist. She has led disability rights and inclusion investigations into institutions for children with disabilities in Ukraine from 2012 to 2016. And developed recommendations and advised government and international donors on the protection of institutionalized children and promoting their full family integration. We are so fortunate to have this expert and esteemed panel among us. We'll start first by hearing from Ala regarding the findings from the SAMS report. and hoping that Ala, you can give us an overview of why SAMS initiated this important report and what were the main findings. Over to you, Ala.
Thank you, Diana, and good morning, good afternoon, everyone. I think the rationale behind the research is very simple. Decisions are made about healthcare decisions, and health planners make decisions about patients and priorities. And we wanted to bring the voice of people with disability and patients with disability into the conversation. And there are three levels that we thought about. The level where resource allocation happen, where decisions about what are the priorities, where, and that kind of thing. And then there's also the governance of the healthcare system in Northwest Syria and policy decisions. But we focused more on on practical implications. One, we wanted to hear from the patients with disability directly about their perceptions of the barriers to access healthcare. We also wanted to listen to how they solve these problems, these barriers, to get an understanding of what works for them and bring that information triangulated with information from the frontline workers, from the practitioners in the field, and bring that understanding of the barriers and understanding of possible solutions to decision makers. And in terms of, we also wanted to look at how SAMS is doing in terms of accessibility, in terms of the prevalence of disability among the patients of SAMS. And the findings, I'll invite you everyone to read the report, but the findings quickly. In terms of prevalence, we found that the presence of people with disability among the patients of SAMS is comparable to global numbers, which might indicate that the primary healthcare services mainly are offering equitable services. But we wanted to dig deeper, and we wanted to see if there are actual barriers. The number one barrier we found, and again, this is specific to Northwest Syria, was in terms of a structural barrier, was transportation. Getting into the hospital, and for most of the patients, if they require repetitive visits to receive some kind of interventions, that's when the challenge, you see a drop in their ability to continue and sustain their engagement with the treatment they need. In terms of financial barriers, the cost for transportation came again, and the cost for some type of services, and that is a challenge in Northwest Syria, particularly for chronic diseases and for tertiary type of healthcare services, where the focus is mainly in a humanitarian context on primary and secondary, and then when you go up the layers, you see that services are less available, and they become expensive because to compensate for the availability, they become paid basically. That's the second major learning we had. We wanted to look also at attitudes of the healthcare workers, and we saw something very positive in terms of high levels of empathy. But we were careful about how we can kind of communicate that, because it could mask sometimes a lack of level of empowerment. What I mean is, most of the answers we received was that there's someone always helping the person with disability to come to healthcare, and there is someone always taking care. And is that a good thing? Is that a bad thing? It obviously depends on the conversation we have with the specific culture and how is that perceived. But it could mask that the way services are provided depends on the fact that there's someone helping people with disability. And I'm sure you'll read more about that in the report itself.
Thank you, Ala. And I wonder, before we dive into how the findings from this report apply to other contexts of conflict, if you can share a little bit of an overview of what types of disabilities were seen in the Northwest Syria context to help our audience have a better understanding of the greatest needs.
So the literature and that SAM's findings showed that one out of three of disabilities resulted from the war. So we have a lot of disabilities related to injuries. In terms of looking at the distribution of the other disabilities, it is comparable to global figures in terms of functioning disabilities. We didn't look specifically at what type of disabilities is more prevalent than the other. We were more interested in looking at the accessibility aspect. But before diving into comparing that to the result to the other context, I wanted to share quickly some kind of recommendations that we heard from the community, and it's important to be passed to our audience and the decision makers. One thing we identified is that when we look at transportation, it's a complex developmental issue. It's not solved just by the healthcare. It's an issue that requires planners and decision makers to think about it and spend more time looking at it from I want to say from a problem orientation, not a solution orientation. Why is it a problem? And dig deeper into what is exactly happening there. Because a lot of the solutions we saw was something is missing, let's provide it. But what Northwest Syria needs is a more sustainable approach, an approach that works with the community on solving that kind of problems. And in terms of an interesting kind of recommendation at the policy level is that some of the barriers that we saw is that some kind of supportive services that the patients need, like transportation, is disallowed in some kind of the funding mechanism. So they look at healthcare provision, but they don't look at how the patient would come and what do they require. And the NGOs struggle in covering these kind of additional costs, whether that is from the protection perspective or from the healthcare perspective. So there is an element of policy change that could help removing the barriers, but mainly it's about prioritizing solutions to these complex problems.
Thank you very much, Ala. And I'm sure we'll get into the details of how the findings apply to other contexts in the broader discussion. But I will move now to Special Advisor Sara Minkara, who is going to highlight aspects of U.S. government policy to addressing disability challenges and conflict. So, Special Advisor, I wonder if you could speak to us about the different U.S. government humanitarian programs in Syria and how they're currently operating in this space, and what are the plans for the future with regards to these programs?
Yes, definitely. I'll actually talk a little bit more general. Our office is very much policy related, not programmatic or humanitarian assistance specific. But just to Alaa's point, Alaa, thank you so much for that research and for that work. It's so needed. And we need more of this research and data and stories across all areas of crisis and conflict. From our understanding, and Alaa, correct me if I'm wrong, and others, above age 12 in Syria, 30% of the population have some sort of disability. So actually, it is greater than the average global stat, which is 16% on average, right? It's 30% in Syria, greater than the age 12. That's a huge number. And going back to Alaa's research, the research was talking about the healthcare dynamic. That's one variable, one area, one dimension. To your opening intervention, Sayana, it's, conflict, crisis, and disability. We're looking at barriers when it comes to healthcare access, employment, infrastructure, livelihood. And then if you take a step back, when a crisis happens, the challenges from all areas of evacuations to accessing shelters, to be able to actually live, a dignified life. Society says persons with disabilities are vulnerable in our vulnerable moments of crisis. And I say we're vulnerable not because we are disabled. We're vulnerable because from the beginning, from the get-go, society does not see us and sees us from a point of incapability and barriers. What society doesn't realize, when you bring actually into emergency planning the disability accessibility lens in any context, right? Accessibility baked into NGO responses to humanitarian assistance, government emergency planning, all aspects, that actually will benefit everyone. And that's the narrative that we need to keep pushing out, is how do we, when we bake in accessibility for persons with disability, it will be a benefit for everyone. This is not specifically conflict related, but the UN said in emergency crisis, disaster crisis response, people with disabilities say that only 8% of people with disabilities feel like their local government responses are even inclusive of disability, right? So the numbers are staggering. The numbers are very horrific in terms of how the disability community is not being seen. We do have the UN Security Resolution 2475, which says we need to really ensure and address disability in moments of conflict and crisis, but we're far beyond that. And the question I will keep asking us is, why are we, as a global community, behind? One is stories and data. Data is very much in many spaces not collected, stories are not shared. We need to amplify those voice and perspective, and this is why this session is super important. Two, we need to actually share practices on the bilateral, multilateral spaces. We need to make sure that countries in crisis, and when Helena will speak on Ukraine, right, and Ala is talking about Syria, there's a lot of things that we can be learning from each other, but how do we then take it, to Ala's point, into the policy making? How do we ensure policymakers are thinking about this? How do we ensure humanitarian aid that's going into any country when they're supporting NGOs? To Ala's point, and NGOs need to also have the support to make sure that their services are accessible and inclusive for all. And that's something that BHA, the Bureau of Humanitarian Assistance of USAID in Syria, is doing, is the twin track approach. Making sure on one hand, our NGOs that we are supporting have that lens, but also there's more disability specific programming. Like for instance, in non-regime areas like Raqqa, there's, we've been focusing a lot on disability employment through partnership with Hope Makers, right? But again, there's more to be done. And I will always ask the question, why is there this gap? Who else do we need to bring to the table? What are the difficult conversations we need to have? Because there are difficult conversations that we still need to have. How do we support each other, building capacity and share best practices and good practices? And how do we ensure that people with disabilities' voices are at the table, not from a point of sympathy, to Ala's point, but from a point of empowerment and from a point of value? So there's a lot to be done, and I'm just grateful for this, for the panelists here, and for the audience that's listening in.
Thank you, Special Advisor Mankar, and we are grateful to you for taking the time to join us and to highlight these critical points. Thank you for mentioning the importance of generating evidence on this topic, as well as increasing accessibility across all humanitarian programs. You did touch on also, who else do we need to bring to the table? And I was curious if you could speak to our audience about sort of how different institutions work together to promote accessibility in conflict contexts, maybe even particularly how the US government approaches this, and bringing different NGOs, even private, public sector, in coming together on this issue.
Definitely. So every single stakeholder sector within our society plays a role when it comes to, crisis, and especially on the recovery reconstruction side of things. So right now we have the Ukraine Recovery Conference coming up in Berlin in a few weeks. And the three main stakeholders are civil society, private sector, and government. So in that context, having, of course, civil society voice is really important, but how do we ensure that also the private sector is thinking about the disability accessibility lens? How do we ensure investment that's going into Ukraine is actually thinking about that lens, which is an important lens? We don't want to be able to think about recovery and reconstruction without accessibility being an important variable that's woven throughout any effort that's happening. Another stakeholder and sector that's really important to bring to the table is actually the media. How do we get more journalists and more media to talk about this topic? How do we ensure that also it's spoken about from a point of, it's not from a point of value, from a point of this is an important issue to bring to society? Journalists and media has a bigger role to play. Investment and also humanitarian assistance. How do we create more accountability that whatever aid is going into a country when it comes during moments of crisis, there is a disability lens? Yes, most implementing partners have a disability policy. Great, but when it comes to the on-the-ground actuality implementation, because yes, it is a crisis, a lot of times persons with disabilities are the last to receive aid or last to even be considered because of the multiple challenges. So how do we address those challenges? And how do we get to a point where, the disability community is not forgotten and not left behind?
Thank you for highlighting those important actors. Agreed that the media is critical in terms of how these stories are shaped around individuals living with disability, as well as research in this regard, as the work that Ala highlighted. Lastly, Special Advisor Minkara, can you highlight what are the geographic areas of U.S. engagement where disability and accessibility are the largest issues? This will be a good segue into Helena's on Ukraine. Yes.
I mean, to be honest, accessibility, disability is a challenge across the globe, and our office does cover the globe, and we've been focusing a lot on Ukraine. So, you know, the work of Helena and others on the ground in Ukraine is really important. We've been focusing on Gaza. We've been focusing also on kind of the disaster response side of things. Our work, to be honest, you know, we work a lot in the ASEAN region, APEC, Asia Pacific Economic Cooperation, C5+1, so the Central Asian countries. And then also a lot, and the G7, this year we'll have the first ever G7 Disability Ministerial meeting in October, and then also on the bilateral front. But when it comes to crisis, Ukraine has been a big focus of ours for the past 2 years, and now we're focusing a lot on Gaza.
Appreciate you taking the time to be on the panel with us. Now I'll move to Helena in Ukraine, who's the Disability Rights International Director. Helena, we were wondering if you could speak to us about particular challenges to accessibility and disability rights in the Ukrainian context, and what resources do Ukrainian partners and NGOs need to achieve their goals in this area?
Hello, everyone. Thank you, Diana. And thank you for including myself and Ukraine in such an important discussion. I represent DRI Ukraine, which is a local partner of DRI, an international advocacy organization dedicated to full integration of people with disabilities into society so that they are free of discrimination and segregation and can fully enjoy their rights and live the life of dignity. And accessibility and barrier-free environment are essential to this. I was listening to Ala and I couldn't help but just nodding every time he was mentioning the findings in Syria, and same with Special Advisor. It is such a global issue, accessibility, and it's long overdue. And physically, Ukraine, especially outside of big cities, was far from universal design concept even before the full-scale invasion. What I mean is, this is something that Special Advisor Minkara mentioned, that disability community was invisible and is invisible even in areas free of conflict. So in Ukraine, most of the schools and kindergartens and public administration buildings and even hospitals, imagine, even hospitals were not accessible and are not accessible up to now. And with the start of the full-scale invasion, we faced multiple challenges due to this, because as we all know, the conflict, the war only exacerbates the issues that are already there. So a complete lack of accessible transportation, again, I could reiterate what Alice said, both transportation being accessible and financially accessible, then accessible buildings, including bomb shelters, and accessible air alert systems. All of that compromise the safety of citizens of Ukraine with disabilities. And the ongoing war in Ukraine demonstrated clearly to our society the importance of accessibility. Out of the sudden, everybody understood how important it is and how it may cost lives. Last 2+ years of full-scale invasion led to increased number of people with disabilities. Officially, from 2.7 million to 3 million. However, the real numbers are definitely higher. We still have big problems with data in Ukraine. We don't know number of people, like real number of people with disabilities in Ukraine. Number of children are also quite inaccurate and vacillate around 163,000. But in our in public sector, we believe they are much higher. And the concerns of accessibility has become quite a priority for both Ukraine governmental and private sector after the full-scale invasion, again, because the war shed light on all of these issues, and especially of the context of rebuilding Ukraine and the broader concept of Ukraine recovery. However, the major focus on physical accessibility does not, unfortunately, take into consideration, for example, other types of accessibility, such as access to social services, access to employment, or to education. Just because you have a disability, you might be denied the access to all of this. There's even less obvious side of accessibility that I want to mention here. The Article 19 of CRPD that recognizes equal rights of all people with disabilities to live independently and be included in the community with the freedom to choose and control their lives. In Ukraine, still, there is a large population of institutionalized children and adults with disabilities, namely with disabilities. And people in institutions do not have access to education or even proper care. What is more important, most institutions are far from accessible as well, meaning physically accessible. We are aware of multiple cases when institutionalized children did not learn to walk or were not able to move or physically develop because the building itself was inaccessible. There were, for example, no such a simple thing as a rail on the wall to enable somebody to learn to walk. And ironically, people with disabilities, especially children with disabilities, are placed into segregated institutions also for a lack of, for a reason of a lack of accessibility in society. Imagine a woman caring for a child with high support needs who is in a wheelchair. A child keeps gaining weight while growing up and needs a bigger and heavier wheelchair. They live in a building in community with stairs and no elevator. Every year, it is more and more difficult to get outside. Even if elevator is there, the pavements and public transportation are not accessible. Even before the war, it was one of the reasons why parents would place their children to institutions at around age of like a teenage age. And also institutions were one of the biggest barriers for people with disabilities to be evacuated from eastern and southeast oblasts of Ukraine. Institutions, in our opinion, are literally the largest invisible to society and unrecognized by it barriers in lives of people with disabilities. Nevertheless, they are right now what we see during the, especially during the full-scale invasion, they are being actively rebuilt with private donor money. We're not talking about international community, but we are talking about private NGOs, private foundations that keep rebuilding these islands of segregation in Ukraine. So Ukrainian partners and NGOs clearly need resources to advocate, to continue advocating for full inclusion of people with disabilities. And resources need to be invested to promote community services and support to families who are struggling to keep their children in community or to keep their family members in community. And disability community needs resources to become better organized with their voices and participation. I cannot stress enough the participation. Special Advisor Minkara mentioned London Ukraine Recovery Conference last year. It was very poor on participation of people with disabilities and family members, almost inexistent. And participation has to be stronger, decision-making around accessibility and barrier-free environment in all senses, not only in something that is clear. Only then we can truly talk about inclusive Ukraine recovery and inclusive humanitarian response.
Thank you very much, Elena, for painting that picture about the situation in Ukraine and the not only the existing and remaining challenges, but also opportunities. So highlighting the role of the private sector. And I'm hearing loud and clear from you and others on the panel about the importance of participation of individuals with disabilities as well as their families, which remains a huge gap. Regarding resources that still need to be invested, do you feel that donor countries or countries that support Ukraine, including the US, are doing a good job of supporting institutions that do this work on accessibility? Do they understand these issues enough? What is the kind of work that you do at DRI to make sure that this message is clear for all stakeholders?
Well, first of all, before I even start, I would like to underline again how grateful we are in Ukraine for all the help and continuous, I stress the word continuous support from donor countries and from our partners. So this is very important, and we're eternally grateful for that. In terms of optimizing the support and understanding the concept better, I believe, and again, I will repeat what I said already, I believe it is very important to ensure a participatory approach on all kinds of levels, and especially to include the marginalized and vulnerable and at-risk groups, to try to do it proactively. The biggest gap in understanding, the biggest gap that I see, that we see in our work, is that understanding the extreme harm of institutionalization and how institutions are deliberately written off from the barrier-free strategies. When I say deliberately, I mean because of the complexity of the phenomenon, it's very difficult to deal with that. It's easier to just close your eyes and not see it. So we believe that this is our one of our main vectors in advocacy in DRI Ukraine and DRI globally, that we try to ensure the understanding that institutions are bad, they cannot be supported, and they cannot be just left there without support and without, we cannot just do anything, do nothing about it. So we believe it, and this is what we are trying to achieve in our work, through our work, that it would be great if the donor communities proactively demanded full inclusion and accessibility for children and adults with disabilities that are now especially those who are now segregated in inaccessible institutions, because we believe that even those people with disability that are not in institutions right now are at risk of being institutionalized, and the numbers of institutionalization cases are increasing during the war. We see that. And we also believe and work proactively on including the voice of parents of children with disabilities and youth with disabilities, so that they are also included into all of the decision-making processes, starting from the local level, national level, and then maybe even international level.
Thank you so much, Helena, for emphasizing the importance of including children and families with disabilities in demands to donors and also larger stakeholders working on this matter. I'd like to move to questions for the broader panel. So all three of you are welcome to respond and thinking about recommendations for moving forward. I have a series of questions, and then one that really came to mind as you were all speaking is, this concept of vulnerability or intersecting vulnerabilities that occurs in contexts of conflict for individuals living with disabilities. What do intersecting vulnerabilities look like? I see personally in donor reports, the importance of highlighting women and girls, for example, the elderly. Do you mind, from maybe your research, Ala, painting a picture of who these individuals are? What do they look like? What are some of the intersecting vulnerabilities that are facing these populations in Syria, particularly, to start?
Yeah, I think it's a good reminder for everyone that we're not looking at recipients of aid or beneficiaries. We're looking at human beings, and they are as complex as each and every one of us here. And it's not just it is that specific experience that they had in their specific context. So I'll give you an example. Sometimes when we give labels, it misleads the information. When you say internally displaced person, you need to go deeper and say displaced from where to where, because that changes the whole idea. But in general, what we found in this report, that women in particular are more vulnerable. And again, this is something we heard directly from the community. This is not something that we kind of extrapolated from, research. Is that they face more challenges for transportation. They need more support to get to what the places they need. When we looked at children specifically, the challenge there was a surprise for me, although I worked in the same context for more than 12 years, that there are certain services that children need that could help them to develop during their development ages. Say, for example, using a hearing aid. And the challenge is that it is looked at as a one-time, kind of gift to the child, but it requires long-term rehabilitation and long-term interaction, which again requires long-term engagement with services. So when you look at children, there are so many varieties within that group of needs. In Syria, Northwest Syria, we're struggling with, for example, a field like neurology or neurosurgeons and that kind of specialization in Syria. And children need some kind of assessments. And that was one of the main barriers, very specific to this age group, very specific to this context. So I think my recommendation is to always go as much as we can to the local level and have a clear definition of what do we mean by local when we want to be accountable to the people that we're trying to serve. What is the local level? And if I want to link that to Special Advisor Sarah's question, who is missing from the conversation? I think the people with disability are missing from the conversation, are missing in the sense that it's not enough to have several people representing. You need to have an actual representation, an actual participation that is empowered, not out of empathy, but out of empowerment. How do you do that? You need to ensure that civil society organizations that represent people with disabilities, parents of children with disability, unions of people with disability, are actually taking part in the design of interventions, are actually giving feedback on how healthcare services are being provided. And the key word there is that services or service providers are accountable to these people, are accountable to these groups, not just witnessing decisions, but they need to respond and need to be accountable to them. And depending on each context, you have specific groups or specific vulnerabilities that you keep trying to include in the conversation in an accountable way. That would be my recommendation.
Thank you, Hala. Accountability is a critical issue here, I think, at various levels, including at the local level, as you mentioned, national level, globally. Perhaps this is a good place for Special Advisor Minkara to come in on this conversation that we've started about intersecting vulnerabilities. Who are the most vulnerable? Who are they beyond the labels? And how do you tease this out at a global level in some of the policy work that you do?
So to Ala's point, it's a really important how he described kind of the intersectionalities, and we are complex as humans, right? And one community that I think the society doesn't see us as, there's a lot of caregivers with disabilities. And there's right now a lot of conversations on a global scale talking about care economy, care reform, how do we provide, and caregivers, and then disability communities just seen from a care receiving side of things, which we do receive care, but we are also caregivers. And there's so many stories and moments of crisis where parents with disabilities, and I have a lot of, firsthand testimonials, parents with disabilities, they have kids and they're saying, we don't know what to do. We don't know how to evacuate. We don't know how to protect our children. We don't know how to, be able to go to safety, right? Again, this is an important lens as we talk about the intersectionality, whether we are caregivers, whether we are women, whether we're children, elderly. There's so many different elements. And I think this goes back to global communities. There's so many different conversations on women's right, care economy reform, youth and children's right. How do we ensure that the disability community is very much brought into those spaces and conversations and are also sitting at the table? A lot of times we tend to be pigeonholed as a disability community into, the main disability spaces and conferences. I think it's time, and yes, there is efforts for us to be brought into those other spaces, intersectional spaces. But to be honest, when I travel the world, I'm still having conversations where the disability community is saying the women's right movement is not inclusive for women with disabilities and are not making those spaces accessible. The pro-democracy movements are not accessible for persons with disabilities. So again, I think, how do we get mainstream organizations, NGOs, to be able to bring the disability lens more intentionally to the conversations and to the design and implementation of programs and services?
Thank you so much, Special Advisor Minkara. Those are incredibly important points. I see you referencing also this, and you did in your previous remarks, this concept of dignity. So how you can make individuals living with disabilities feel more dignified, more included.
She froze.
Elena, I was wondering if you could speak a little bit about the concept of dignity and what can be done at a high level to ensure that individuals with disabilities feel dignified.
Oh, yeah, thanks, Diana. I just wanted to first just comment on, was very could relate to what Alice said about intersecting vulnerabilities on women. And especially, I just need to bring up the issue of Ukrainian women caring for children with disabilities during the war right now in Ukraine, because usually they are either IDPs, internally displaced, or they are not internally displaced. They did not go to safety because they had a child with disability and they couldn't evacuate them because of transportation or other adaptation issues on the new place. In our work, we had different stories like that in our research. And very often, and I'm really grateful to Sarah for bringing up this topic of disabilities of caregivers, because caregivers, especially women who are caring for children with high support needs, they are developing not only physical disabilities because they don't have time or ability to take care of themselves and they burn out. They are employed 24/7 doing that, but they also have a very often invisible disabilities such as mental health issues that they develop because of the lack of support and because of the isolation that they are doing this in. Again, this connects to the lack of accessibility. And in terms of, so that's the intersecting vulnerabilities, being a mother of a child with disabilities in Ukraine and having to make a decision whether to be an internally displaced person who is taking care of the child without the support of the partner, or staying in the place where they don't live, or staying in the place where they live, for example, Zaporizhia or whatever other region, Kharkiv, under shelling. And it's a hard decision to make, and we face it every day in the stories that are shared with us. And in concept of dignity, we were talking in the very beginning about the findings of the Syria report, that very often there's someone helping a person with disabilities, which is again a very sensitive issue, because there could be help with dignity and there could be help because the environment, the whole system is not accepting and not accessible. And therefore you need to have another person helping you. While a life with dignity, and when you have the control, this is when when you can choose to do it yourself if you can, or you can choose to have someone else next to you. It's all about choice and about control over your life. In Ukraine right now, it's not, we're not there yet. The concept of personal assistance with dignity, the concept right now, the assistants to children and to youth with disabilities are usually adults who might be hyperprotective because they don't know anything better, and also because the environment is so inaccessible that even if a person with disabilities wants to do something by themselves and independently, they're not able to, only because of not because of their disability, but because of this contact with the environment. It's like, it's pure CRPD when the disability it is created on as a contact of the person and the barriers of the environment. So I mean, we have to think every time we do planning and we talk about support, we need to think about this. We need to have the dignity concept inside, so that we don't apply the concept of care to adults with disabilities, because they don't need care, they need support.
Thank you so much, Elena. I really like the concept of dignity as it applies to an environment. So even a dignified environment, and how, if that doesn't exist in a pre-conflict stage, how that can set up even additional challenges for a context entering the conflict stage. Just a reminder to our audience to please ask any questions of the panelists. We'll make sure to address these in a few minutes. I'm going to go back to my question earlier for you, Ala, about the contextualization of the findings of your report in relation to other contexts that even SAMS has worked in, like Ukraine or Gaza. And a broader question for the panel, which is how do recent conflicts like in Gaza and Ukraine say about our ability to achieve accessibility even in the most violent conflicts? So over to you, Ala, first.
Yeah, that's a tricky question. Gaza is a completely different story. There is, I think, no humanitarian response is going to work without a ceasefire. And the humanitarian organizations have been very clear about it. The question on Gaza is about availability, about functionality of the healthcare system, because there's a total collapse. It's not yet about access, but this should not stop us from raising the voice about how the conflict impacts people with disabilities specifically, how their struggle is even more harder in terms of escaping and the type of challenges that they face in these situations. Now, if my recommendation in terms of how can we use the data and use the learning in terms of contextualization is, again, to always keep in mind that there must be a conversation driven by the local community and find a way to remove barriers and define the right level of local participation and keep thinking about, are we inviting the right people, and is the discussion inclusive in that sense, and what kind of barriers? Local should not mean NGOs all the time. It could mean NGOs sometimes. It shouldn't mean all the time. There shouldn't be one kind of solution. And the other thing I wanted to highlight, and I think our research highlighted, was that in terms of thinking about what works in removing these barriers, I think we need to be humble enough and go and ask and look at positive deviance in the community. Look at what is actually working, because a lot of people are trying to, at the local level, at the community level, trying to find solutions, their own solutions. And I think from what our research showed, that these solutions often work better than the solution that we bring from top down. And in addition to that, empowering them to find their own solution is, again, a way of improving accessibility, because you want that sustainability, you want that solution driven by the community. And instead of, we have standards and we keep promoting them and we will keep advocating for policy change. But in terms of designing what works, we need to add that element and allowing the community themselves to try solutions and scale up what is working for them and learn from that. So we take it to other contexts, because there's great learning there after you spend that time with listening and empowering and learning from their solution. You can take that to other contexts as well.
Thank you, Ala. And especially, agree with your point about not reinventing the wheel. A lot of work has been done in terms of promoting accessibility in conflict contexts, and learning from, other violent contexts like Syria is critical, so that we don't have to start from scratch in recent conflicts. Special Advisor Minkar, would you like to also come in on how recent conflicts, what they say about our ability to achieve accessibility even in these situations?
So I want to underscore what Ala said. I think it's really important for us to identify the local community driven solutions and responses, and I think those tend to be very much aligned to what the community wants and needs. And this goes back to, how do we really elevate and share those practices globally? There are amazing practices that we saw in our travels, whether it was Chad. Sorry, I haven't been to Chad, but Chad was a community that we talked to, whether it was Kenya, whether it's Philippines. There's a lot of different amazing practices that are done on the local community level. We need to be elevating those stories. The only other thing I want to say, and I'll keep this short, is, one time someone said this, whoever is not counted does not count, right? And that was actually a very powerful statement. And it goes back to, crisis response, and whether it's during the crisis and then whether it's during the peace building, recovery, reconstruction. How do we have more disaggregated data on the disability community? How do we really illustrate the current situation of persons with disability, the stories, the data, and that will then illustrate to the world what more needs to be done and where are the gaps and also where the great practices. Again, there's not enough I cannot underscore how much there isn't enough disaggregate data on disability during moments of crisis. So more of that needs to be done, and then more sharing practices from across the globe and creating those spaces to be able to share those practices. There's a lot of great things out there, and we need to keep kind of amplifying those cases.
Thank you, Special Advisor. And clear that gathering data, presenting evidence like those in the SAMS report are critical first steps to elevating and sharing global practices. Thank you. And Helena, anything you'd like to add on how conflicts like Ukraine say about this issue of accessibility, or what they say about these issues? I know you've touched on a few pieces. If you'd like to emphasize maybe new lessons learned emerging from the Ukrainian context, that would be helpful.
Lessons learned from Ukrainian context is that we are at war for the last 10 years, even though the world knows about it only for the last 3 years. And we already had these issues when caregivers were becoming prisoners of war because they did not evacuate from the territory that was occupied by Russia, only because they were caring for their family members with disabilities and did not have accessible evacuation routes. So this is something that just comes to my mind. And this person is already not with us, but he related a lot. He was a prisoner of war, and he came back from a famous Ukrainian professor, came back from the captivity, and he was just relating on this experience. And then recently we have these stories of whole institutions of multiple vulnerable people in one surrounding, segregated, and who were not evacuated only because of their disability. Not because there was no political will to evacuate it, but because the routes and the way it will be done physically was not thought enough before the conflict. And then when you have a situation of war and conflict, you cannot do this immediately. So this is a lesson learned that we have to take it further, because it's not only about war, it could be any other natural disaster. So there has to be emergency planning around people's disabilities. And if we don't even know how many people and what their needs are, then we cannot in a quick way to provide, for example, even such a simple thing as transportation and further accommodation for them. We saw that in Ukraine. We keep seeing this in the last 2 years. And also another thing that both Sarah and Ella mentioned about, to me, what is to me a regenerative leadership model, when you include people who are going to benefit from the programs into the dialogue right from the beginning of the designing of the concept, not testing, but even at the beginning, at the very start of conversation. Again, this participatory approach and having everybody at the table who are involved, which means all of the community, if we're talking about inclusive community, not having separate women's movement, disability movements, veterans movements, other movements, just having everybody, like having a community as a unit of start, instead of segregating even on the level of the concept. I guess that's something that I see now, and that's something that I'm frustrated about. And this is something we have to learn from all the conflicts finally, and just use it further to with a focus on prevention, not on the focus already on reaction.
Oh, thank you for highlighting that. The prevention contingency planning aspect beyond just conflict context is critical. Thank you, Helena. I think we have time for one more question, and we do have someone who posted one question online. For other audience members, you can go to askac.org and post questions, and we can see if we have time for it. So from Samaher, there's a question about how is the persecution and infrastructures of support for some of the less visible disabilities, like chronic illnesses, autoimmune diseases, mental illness, which are recognized as disabilities in the West and are very common in conflict settings. Do one of you want to comment on this, on these particular types of disability, less visible disabilities that Samaher highlighted?
Yeah, that was actually one of the findings of our research, is that something like multiple sclerosis, for example, or other types of chronic diseases where, unfortunately, in Syria, what is happening with the reduction of funds is that donors and implementers will start thinking about prioritization. And there's a term commonly used in Syria, which is called life-saving aid, which immediately move out of the some of the major needs of patients, because they're labeled non-life-saving, but they live a life that is full of struggle and so painful. And in anyone's standard, you won't call it a proper life because of that kind of policy, high-level decisions. So I think the first thing I want to say is that it's not always about including them under, maybe in the United States, it could work because you've gone so far in terms of once something becomes under a policy or under the law, then you are able to mobilize resources and mobilize people behind it. But in conflicts and crisis context, and in a context like Syria, where if something is in the law, does not mean necessarily that it will get more attention, basically, then there should be more effort into going into those three levels I spoke about. Where are decisions about priorities of resources made? And it differs from one context to another. And then what are decisions about policies that say this is allowed, this is not allowed, policies that allocate funds, policies that disallow certain funds. This is where we need to have people with disability present with a strong voice and to say, look, if you're stopping this, this is the result. This is what we're losing. And I think the chronic disease in Syria, because of reduction of funds, is becoming a major issue, which also include cancer patients. And SAMS have tried to do a lot about that. But again, that kind of thinking or labeling of what is important, what is not important, particularly when funds are reduced, this is where you need the people with disability to be present on the table.
Thank you very much, Ala. And a critical point, I think, touching on the idea of intersecting vulnerabilities, so different conditions and how they can exacerbate certain needs, but that remain hidden in conflict contexts. Does anyone else want to add something to that question about less visible disabilities? Elena, our special advisor.
Is Sarah speaking or?
Go ahead, Elena.
Oh, sorry, because I thought maybe you're muted and speaking. No, we are struggling a lot with the invisible disabilities, especially because they face even more barriers than all other disabilities. Also, they're more stigmatized. And so in the context of war, we see a problem with the lack of access to services. Again, we go back to medical services, and because a lot of the service providers are reduced, there are like fewer of them, like physically on the ground. They're also more expensive, and the financial barriers are greater during the war. So it is something to consider for sure. But in terms of invisible disabilities, we also have a lot to say about the veteran movements and the trauma of the war, coming back from the war, trauma and mental health issues. We are still about to face it in terms of data, because right now this is happening, but we don't have any findings on that, any data on that. But we know that veterans and their family members, prisoners of war coming back to Ukraine, that they're all struggling with invisible disabilities, even if they don't have any other comorbid physical issues because of what they had to survive. So we're still about to see the full picture of it, unfortunately. And again, we need to do this with a focus on prevention and on the thinking ahead instead of already facing what harm is there.
Absolutely. And thank you for highlighting mental health as well, Helena, and sort of the recovery aspect, coming back home, returning. Thank you all so much. I'm aware that we're over time, so I just want to express our gratitude for each of you for your willingness to participate in this discussion and the tireless work you're doing in your respective contexts. Your perspectives on the impact of conflict on communities living with disabilities have been very enlightening. Thank you to the Atlantic Council and the Syrian American Medical Society for hosting this important event. And let's hope that we can turn your vision into reality on promoting inclusion of those with disability in conflict contexts. Thank you for our audience members, and I hope you all take care.
Thank you.